Yeah. Hello, students. A very good afternoon. Welcome to today's class, and it's the last part of our chapter, excretory products and their elimination. So before we wind the session up, so let me do a technical check today. Okay. So I'll launch a poll for technical check. Please let me know if my audio and video is clear. I've launched a poll for technical check. And people from YouTube, you can text in the chat box if there is any technical issues. Okay. Okay. So I will end the poll now. If there is any problems with technicalities with respect to audio or any visibility problems, please let me know. Okay. So let's start the session today. So we're studying about excretory system, isn't it? So today we have to study the disorders with respect to excretion, okay, and excretory system. So before that, we have some questions to solve. Yeah, here is your first question. Brush border is characteristic of. So here are your options. Neck of nephron, collecting ducts, proximal convoluted tubule, okay, all of the above. So I will launch an MCQ. Okay. Hold on. Sorry. Let me launch a poll now. Yeah. I hope the poll is visible for you. Okay. So the question asked here is, brush border is characteristic of which of the following? Okay. Neck of nephron, collecting ducts, okay, proximal convoluted tubule, and all of the above are the given options. You can choose your option from the launched MCQ poll. And students from YouTube, you can just post your answers in the chat box. These are all 1-minute questions, so you shouldn't delay. All right, students, I'm going to end the poll now. So let us discuss the answer for the question. Okay. So if you have chosen option C, that is proximal convoluted tubule as your answer, then it is right. So brush border is a characteristics of proximal convoluted tubule. So if you say proximal convoluted tubule, it is very efficient in the process of reabsorption. Okay, reabsorption takes place in a very efficient way in proximal convoluted tubule, right? So how does this happen? This happens because of specialized cuboidal, okay, cuboidal epithelium. Sorry. All right. Okay, cuboidal epithelium. So the type of cuboidal epithelium that is present in the proximal convoluted tubule is having brush border characteristics. So what is this brush border characteristic of cuboidal epithelium? See, if you see that proximal convoluted tubule, they have some mucosal modifications where the cells have the projections of microcilia, okay, or microvilli. So this microvilli, it increases the rate of absorption, which enables the proximal convoluted tubule to absorb all the essential products from our filtrate that is formed from the lumen of the Bowman's capsule. So usually it helps in absorption of many of the important substances like glucose, electrolytes, okay, as well as water. So our option is C. Okay, you have your second question. Reabsorption of useful substances from glomerular filtrate occurs in. Okay, and our options are collecting tube, loop of Henle, proximal convoluted tubule, and distal convoluted tubule. I will launch the poll. Okay. So the polls are live. You can answer the question. Okay. Reabsorption of useful substances from glomerular filtrate occurs in. Come on, students, we have 15 seconds left. Okay, so your time's up. I'll end the poll. Let's see which is the right answer. Okay. So the reabsorption is a process that happens in proximal convoluted tubule. Just now we discussed, right? Proximal convoluted tubule have brush border, epithelium. So this brush border epithelium will increases a lot of surface area. So that will help in, okay. Okay, absolutely. No, it's not loop of Henle. It is proximal convoluted tubule. Okay. So the explanation I'm telling you, okay, proximal convoluted tubule has brush border. Remember this. Whenever it comes to reabsorption, around 80% of the filtrate that is formed is reabsorbed in proximal convoluted tubule. Okay. Here, the reason is because of its brush border epithelium that is present, which increases the surface area for all the important substances. Okay. Such as electrolytes. Okay. So our option is C. Okay. So I want to ask you, is the polls visible? Okay. Just put your message in the chat box if the polls are visible, so that we can use or not use, we'll get to know. Okay. Because we have question and answer session in the later part of this chapter. So it would be useful to know that. Okay. Yeah, let's study about disorders of excretory system. And the first one we are going to study is uremia. So what is uremia? Usually what happens when urea keeps on accumulating in the blood, that leads to a problem called as kidney failure. And this kidney failure is also called as CKD or chronic kidney disease. Okay, where a person will have both the kidneys failed and the kidney will not be able to function normally. Okay. So this is a very big problem. Why? Because see, kidneys are very, very important to filter our blood. It has to remove a lot of metabolic waste on a regular basis, correct? No? So whenever a person has a kidney failure, they have to go for some of the options which are not so comfortable. Okay. So what is the option for a kidney failure? I think you have heard about a term called as dialysis. Okay. Dialysis, correct? No? So dialysis is a process where you use a machine called as dialyzer. Okay. So the blood from the patient, from the radial arteries are taken and it is injected into this machine. You can see in the picture. Now what happens is in this dialyzer, the same mechanism that our kidney uses, right? Here what we use is osmotic pressure, and hydrostatic pressure we use. Hydrostatic pressure is used to create a countercurrent mechanism by using a fluid. Okay, we have a dialyzer solution, so which will create a concentration gradient between the blood as well as this particular dialyzer solvent. So here what happens is exchange of all this metabolic waste, such as your potassium, phosphates, okay, urea, and excess amount of water that is present in your blood. All of them is filtered, and it is re-injected back to the filtered blood is re-injected back into the patient. Okay. So dialysis is a regular process that a patient has to undergo now once their kidneys are failed. It depends upon an individual patient. Some patients will go once a week, or some patients will go twice a week. But there is serious problems associated with dialysis, such as a person who is undergoing dialysis will have low blood count. So that is why the doctors will regularly inject them with erythropoietin, which will enhance the formation of red blood cells. That is one thing. And the second thing is, because the blood is driven out of the body, there is high chances of the blood getting clot, right? Coagulation will happen outside the body environment, right? So to prevent that, to prevent coagulation in the tubes, or to prevent the coagulation in the system, what they do is they inject the machine with what do you call anticoagulant factors like heparin. Heparin is one of the anticoagulant factors, isn't it? So when they inject with heparin, that will prevent the coagulation in the machine. And moreover, they have to filter this blood, isn't it? To filter the blood, they use a filtrate, which is made up of cellulose filtrates are used, okay, where the pore size is very, very small. And usually, if the patients who have chronic kidney disease or kidney failure, they undergo creatinine analysis. So based on the counts of how much creatinine is there in their urine, you can tell the proper functioning of the kidney. All right. So the other disease is renal calculi. Okay. So when you talk about renal calculi, you might have heard about a common term called as kidney stones. It is very, very common in many of the people, especially in youth. Why? Because we don't consume enough water, right? So, and our proper food practice is also not good. So what is happening in kidney stone? So an insoluble mass starts forming, okay, which are usually oxalates of calcium, which is a very, very common form of kidney stone. So it starts forming in the, you can see here, right? You can see that the formation of stones happen in the kidney, which is highly painful. Okay. The people who are having this kidney stones, they undergo chronic pains, okay, difficulty and burning sensation during urination. So usually it is either released, either it is removed by laser treatment, or it is through surgery. Okay. So these are the two disorders of very, very common disorders of excretory system. And please remember this. All right. So the next part of our discussion is question and answers based on our current chapter, that is excretory system and their elimination. So let's start our quiz sessions. Okay. Uh, let's start our quiz session. So here we have our first question. Okay. A person is undergoing prolonged fasting. His urine will be formed to contain abnormal quantities of. So we have the options: fats, amino acids, glucose, and ketones. Okay. So I will launch a poll for you now. So you can answer through the poll. Okay, students. Your poll is live now. And you have 1 minute to answer this question. A person undergoing prolonged fasting, his urine will contain abnormal quantities of what? And students from YouTube, I want to see your answers in the chat box. All right, students, I'm going to end the poll now. Your time is up. 1 minute. Okay. Yes, your answer is right. That is ketones. Okay. So usually what happens whenever a person is under prolonged fasting, the alternate form of energy is utilized by our body, which are usually ketones, right? So that is why the byproducts of this ketones will be eliminated in the urine. So that happens only during fasting, right? Ketouria. So ketouria is one of the clinical disorders for the people who go under very prolonged fasting. Okay, fine. So we have our next question. Under normal conditions, which one of the following is completely reabsorbed in the renal tubule? So our options are urea, uric acid, salts, and glucose. I'll relaunch the poll again. Yes, your polls are live. You can answer this question in a minute. Under normal conditions, which one is completely reabsorbed in the renal tubule? Yes. Okay, students, I'm going to end the poll now. Your 1 minute is up. So let's see if you're right. Okay. So under normal conditions, the basic function of our kidney is to remove the metabolic waste, right? And also reabsorb some of the important factors that are used in our body. And one of the important things that are very essential to our body is glucose, right? A large amount of glucose will be circulated in the blood. Usually there is some amount of glucose always circulated in the blood, right? So whenever this blood is entering into our kidneys, so this glucose has to return back to the circulation. Otherwise, whatever the food we are eating, will a lot of it will be eliminated through urine in the form of glucose. That is why under normal conditions, our kidneys are meant to absorb as much glucose as possible, completely reabsorb the glucose from the forming urine. Okay, so your option D was correct. So let's see the next question. Bowman's glands are found in. It's an interesting question. External auditory canal, cortical nephrons only, juxtamedullary nephrons, olfactory epithelium. So these are your options. Let me relaunch the poll again. Yes, your polls are live and you have a minute to answer your question. Bowman's glands are found in. All right, your time is up. Okay, I'll end the polls now. Let's see if you're right. Okay. So there is a difference between Bowman's gland and Bowman's capsule. Okay. So Bowman's glands are found in olfactory epithelium. Okay. The role of this Bowman's gland is to secrete, it's in the nasal cavity, correct? No. So since it is an olfactory epithelium, it is present in the nasal cavity. So its role is to produce nasal mucosa. Okay. So it will produce nasal mucosa, which will prevent the entry of the dust particles, and it will keep the nasal cavity very moist. Okay. So remember, whenever the question comes Bowman's capsule and Bowman's gland, okay, Bowman's gland is always for olfactory epithelium. Understood? Fine. So we have our next question. What will happen if the stretch receptors of the urinary bladder wall are totally removed? Okay, our options are micturition will continue, urine will continue to collect normally in the bladder, there will be no micturition, urine will not collect in the bladder. Okay, so I will relaunch the poll. You can answer this question now. What will happen if the stretch receptors of urinary bladder wall are totally removed? Okay. Okay, students, your time is up. Let me end the poll now and let's see what's the right answer. Okay. So see, if you remember the process of micturition, correct, right? What happens in micturition? Our urinary bladder, right? It will be constricted. And as the urine keeps accumulating, the urinary bladder wall will keep stretching. Okay. As the bladder walls keep stretching, there are stretch receptors which will send a signal to the CNS. Okay. CNS is central nervous system. So in our CNS is basically our spinal cord, isn't it? So we have something called as sacral region of our spinal cord. There are something called as micturition centers. Okay. So these signals will be read by the CNS and then it will relay back to the urinary bladder. And at the tip of your urinary bladder, okay, there are sphincters, correct? No? In the urethra, there are sphincters. So you have internal sphincter and you have external urinary sphincter. Okay, internal urinary sphincter and external urinary sphincter. So if you want to urinate, right? So if you want to urinate, for example, I want to go now. So internal urinary sphincter is involuntary. You cannot control it. Okay, the urine flows through it. It opens, it relaxes the urinary bladder and the urine flows still here. And then your option, okay, option is given to you whether you want to urinate now or you want to postpone it to the next phase. So if you want to postpone it, okay, again one more signal is passed from your external urinary sphincter back to your CNS telling that I want to postpone. Okay, then your signals will get relaxed. Again, after some time, more accumulation of urine will take place in your urinary bladder. Again, it will stretch. Again, the signals will continue, and again you will feel the urge for urination. So here the question is, if the stretch receptors are removed, right, what would happen? Would you get the signal that I want to go and micturate or urinate? Definitely no, right? The signals are cut off. That means you will not get a signal only that you want to have the urge to urinate. So our option will be C. There will be no micturation at all. Okay, fine. Which one of the following is a matching pair? Okay, we have to find the matching pair. So our options are tears, excretion of salt, sweat, thermoregulation, saliva, tasting food, sebum, sex attraction. Okay, so I will relaunch the poll. Yeah, your polls are live. Please try to answer it as soon as possible. It's a very direct question, right? Which one of the following is a matching pair? Find a matching pair. Okay, I will end the poll now. Your time is up. Let's see if your answer is right. Okay, are tears for excretion of salt or to protect your eyes from any of the infections? Okay, the role of it is majorly to protect your eyes from any of the antigens that are entering your eyeballs. Okay, when it comes to sweat, sweat performs thermoregulation, correct? No, whenever we are in a heat condition, okay, our body internal organs will get warmed up very soon and our enzymatic activities will decrease. So to avoid it, what will happen? The excess water, okay, and the salts are eliminated, even urea is eliminated through sweat, and that will lead to the thermoregulation. So our option B is correct. Okay, saliva is for tasting food, definitely no, right? Saliva is having two functions. Okay, one is salivary amylase, which will do the enzymatic function. Okay, and next one you have is saliva. When it comes to excretion, we know that some of the nitrogenous waste are removed through saliva. Okay, and sebum is basically sebaceous glands which secretes oil. Okay, and some of the sterols through our oil glands, okay, in the form of sebum. Sebum gives you waxy coating or oily coating that that protects your skin. Okay, and sex attraction is basically pheromones, so that is not an option. So option B is right. Okay, so we have our next question. Which one of the following does not favor the formation of large quantities of dilute urine? So here are your option. Okay, caffeine, renin, okay, atrial natriuretic factor, and final option is alcohol. So let me launch the poll. Okay, relaunch poll. Students, your polls are live and you can answer the question now. Okay, I will shorten it to 40 seconds. Okay, because let's solve some more questions. Okay, I'll end the poll now. All right. So the question asked here is, which of the following does not favor the formation of large quantities of dilute urine? Okay. See, when it comes to caffeine, caffeine is a very natural, okay. What do you tell? It's a vasodilator. So your urine formation will happen faster, okay. And usually you dehydrate. When it comes to renin, okay, usually whenever there is a decrease in glomerular filtration, okay, so it increases the glomerular filtration, and again, okay, your formation of urine is increased. When it comes to atrial natriuretic factor, whenever your blood pressure, okay, whenever your urine formation, your blood is having more and more flow and the BP is higher, okay, blood pressure is higher. Now what will happen? The atrial natriuretic factor, which contains different types of amino acids, okay, they will start, okay, what do will do? It is a natural vasodilator, okay. It will vasodilate and it will reduce the blood pressure. When it reduces the blood pressure, now what will happen? Now the large quantities of dilute urine will not be formed. Okay. Next one, alcohol usually leads to dehydration. Why? Because it suppresses antidiuretic factor. Okay. So that is why the people who drink alcohol, they dehydrate a lot and they keep urinating. Okay. So our option is C, atrial natriuretic factor. Okay. So here is your next question. Human urine is usually acidic because, okay, why is it acidic? Excreted plasma proteins are acidic. Potassium and sodium exchange generates acidity. Hydrogen ions are actively secreted into the filtrate. The sodium transporter exchanges one hydrogen ion for each sodium ion in peritubular capillaries. Okay, I will relaunch the poll again. You can answer your question in a minute. Human urine is usually acidic because Okay, your time is up. Let me end the poll now. Okay, so let's see if your answers are right. Okay, excreted plasma proteins are acidic, and potassium and sodium exchange generates acidity. Both these options are not the right reason why urine is usually acidic. Whereas the third option, that is hydrogen ions, are actively secreted into the filtrate. So that is why the urine usually becomes acidic. Okay, our option C is correct. Okay, whereas the option 4 is also wrong. So let's see the next question. It's okay if you are wrong or if you don't know the answer, try to attempt the answer so that it will make the class quite interacting. Okay, select the correct statement. You have your first option. Atrial natriuretic factor increases the blood pressure. Angiotensin 2 is a powerful vasodilator. Countercurrent pattern of blood flow is not observed in vasa recta. Reduction in glomerular filtration rate activates JG cells, that is juxtaglomerular cells, to release renin. Okay, I will relaunch the poll. The polls are live. You can answer the question now. Oh, all right, students. Let me end the poll now. So let's see what's the right answer. See, the first option, atrial natriuretic factor increases the blood pressure. Actually, it decreases the blood pressure, right? So that is induced because of the more blood flow that is happening in the atria. That is why the atrial natriuretic factor released so that the blood pressure is decreased. And the second option, angiotensin 2 is a powerful vasodilator. Is it? No, right? Angiotensin 2 is a powerful vasoconstrictor. That is why in the first place renin is released to increase the glomerular filtration rate. So our second option is ulta, okay, or it's not given correct. Next, the third one, countercurrent pattern of blood flow is not observed in vasa recta. Okay, the arrangement of vasa recta on the loop of Henle will create, okay, countercurrent mechanism that helps in concentrating the urinary filtrate. Okay, so that is why third option is also wrong. Whereas when it comes to fourth option, that is reduction in glomerular filtration rate activates GAG cells to release renin. So this is the right option. Okay, fourth option is right option. Okay, which one of the following factors is responsible for the formation of concentrated urine? We have our option: hydrostatic pressure during glomerular filtration rate, low levels of antidiuretic hormone, maintaining maintaining hyperosmolarity towards inner medullary interstitium in the kidneys, secretion of erythropoietin by juxtaglomerular complex. So you have your options, and I will relaunch the poll now. You have 1 minute to answer the question. Which of the following factors is responsible for the formation of concentrated urine? Okay, so I'll end the poll now. let's see what is our right option. See, the right option is maintaining hyperosmolarity towards the inner medullary interstitium in the kidneys. Okay. Now, what happens in the kidneys? We have two regions. One is cortical region, other one is medullary region. So usually when the loop of Henle, okay, as it descends to the medullary region, now what happens? It becomes more and more hyperosmolar. Okay. Since it becomes hyperosmolarity is maintained, okay, now the urine concentration will take place by exchange. Okay. So that is why our option 3 is correct. So our next question is, a decrease in blood pressure or volume will not cause a release of. So our options are atrial natriuretic factor, aldosterone, ADH, and renin. Okay. I'll relaunch the poll again. You can answer your questions. The polls are live. All right, students, I'm going to end the poll now. Let's see which is our right option. A decrease in blood pressure or volume will not cause the release of. Whenever the blood pressure is decreased or the blood volume is decreased, it will not release. Okay, which of the following is not released? When it comes to aldosterone, ADH, okay, antidiuretic hormone, and renin, they are all okay. They're all vasoconstrictors, and usually they increase the BP. Okay, so that is why they are released whenever there is a decrease in blood pressure. Whereas atrial natriuretic factor is not released because it itself is a vasodilator and it decreases the blood pressure. So our option is 1. Okay, so we have our final question. Which of the following statements is correct? The descending limb of loop of Henle is impermeable to water. The ascending limb of loop of Henle is impermeable to water. The descending limb of loop of Henle is permeable to electrolytes. The descending limb of loop of Henle is impermeable to water. Okay, so I'll relaunch the poll again. The polls are live. Now you can answer the question in a minute. Okay, students, I'm going to end the poll now. So let's see which is the right option. Okay. So the options given are, that is the descending limb of the loop of Henle is impermeable to water. Actually, the descending limb is permeable to water. The ascending limb of loop of Henle is permeable to water. Okay. It is impermeable to water actually. So the descending limb of loop of Henle is permeable to electrolytes. No, it is not permeable to electrolytes. Okay. So our fourth option, that is the descending limb of loop of Henle is impermeable to water. So this is the right option, right? So here we come to the end of discussion of the question and answers as well as the disorders in our excretory product and their elimination. Thank you, students. I'll see you in the next class. We'll start a new chapter.